Welcome, ladies and gentlemen. Today, our group has come to present innovation in nursing through our creative works. Let's get started. Start with Empathize Part 1. Tell me one thing that learning performance. How difficult is it? The procedure for doing the procedure is too complicated. 2. What are the important factors that result in being contaminated, drooping, losing consciousness? The edge is only 1 inch. 3. Do you think practicing with the puppets will make us more familiar? The dummy is not responsive. 4. If it is a person who has not yet experienced, is there any way to avoid mistakes from taking care of patients? The teachers stay near at all times in performing difficult procedures. Study clearly again before doing that procedure. 5. What is the most common problem during class? Contaminated. Can suck all the medicine from the medicine and expel air from the medicine bottle. 6. Is there any way that if an error occurs while working, such as being contaminated, then can continue working without having to waste time changing the set? Not yet. 7. If wearing gloves it crumbles. How to manage? Blow, keep putting on like that. Part 2. Show me plus tell me. 1. In teaching, focus on teaching the main steps first and teach the details or tricks later. Can we reduce some steps? 2. Can we make assistive devices to reduce contaminate or not? Part 3. Dig deeper. In performing wound healing procedures, students often encounter contaminate, causing the need to change a new set, which wastes time and resources. Part 4. Design. Something that is useful and meaningful or valuable to friends. We may have to invent methods, tricks or devices to help reduce contaminated during the procedure, such as glove aids, contaminated alert, or application games to familiarize yourself with procedures, etc. Next step is define. Part 1. Personal. Nursing students who are not proficient in wound dressing procedures, this innovation can help in reducing contaminate in wound healing procedures. By making the students familiar with the wound healing procedure before the actual practice, from the meeting of most friends, and it can be concluded that most of them have problems with their experience, causing lack of experience and various techniques, and maybe contaminate frequently. All my friends agree that they want us to make an application game to build familiarity with what we do about the procedure, reduce contaminate. Part 2. Value proposition. Things to do. Prepare tools that help in reducing contaminate in the preparation of various procedures. Prepare the size of the open cloth set to fit the table or to turn off the set. Problem. Contamination occurred at the preparation of the set, either 1. Open set, 2. Aseptic pouring, 3. Closing set, 4. Skipping set. Special expectations. Prepare equipment to reduce the subject of contaminate. Make equipment that can be used by people with less experience. Prepare tools that are easy to use and quickly. Arrange equipment that is suitable for opening and closing the set. Arrange equipment that helps reduce processes or techniques. 3. Problem statement. Problem. The problem occurred while preparing various sets. The problem of preparing most sets is the opening of the set, and the set cloth is too large, causing the glossy cloth to extend beyond 1 inch, or the process of pouring various aseptic liquids must be poured from the cup in a distance of 4-6 inches, causing students who are new and inexperienced to pour various aseptic potions before contaminating or in various preparation stages. Some students are stressed or worried, causing them to lose their consciousness to the point of unknowingly contaminating. Skipping a clean set is considered a contaminate as well, including the process of closing the set to prepare for the procedure. You will encounter the same problem as when opening the set, that is, when the size is too large or too small. It is difficult to shift the fold to make the edge not more than 1 inch. The need for innovation development from the above problems therefore want to develop innovation in the matter of alerting when close to contaminate, and after agreeing with friends in the group to make a familiarization game for wound healing procedures in order for students to become familiar with the procedure. It will be called Reduce Contaminate Game, which will help familiarize them with the procedures in the story of wound dressing. When students are familiar with the procedure, students will be able to focus more on contaminate. It can be reduced in terms of contaminate less. Next step is ideate. Our innovation is a nursing practice game. Our game will be a game with virtual nursing development training from the first step to the last step. In our prototype, there is still only one procedure, which is the wound healing procedure. If you want to bring it to the top, it can be done, which should be developed in the way of games in the form of AR or VR for better understanding of a procedure. And this is our prototype. The game starts at the first checkpoint, preparation process, which has 4 steps. 1. Check authorized healthcare provider's order. 2. Introduction, your name, identify the patient, inform about the procedure. 3. Perform hand hygiene. 4. Perform wound assessment. Assess wound appearance, size, discharge/drainage, redness of skin surrounding wound. Assess pain and provide pain management, following the standard before wound dressing. The game starts at the second stage, which is set preparation stage, open equipment. At this level, the game should be in 3D or VR format to increase the understanding of the procedure. In this level, players must follow the following 4 steps correctly. 1. Prepared equipment for dry dressing. Dressing set, sterile cotton, clean gloves, take waste container, and cleansing solution according to type of wound and type of dressing. 2. Perform hand hygiene. 3. Add item sterile cotton gauze following the surgical aseptic technique. 4. Close the dressing set as mutical aseptic technique. The game starts at the third stage, namely operation checkpoint. At this level, the game should be in 3D or VR format to increase the understanding of the procedure. In this stage, the player must follow the steps to complete all procedures correctly. And this is our game example. Thank you to be attention.